Assalamu alaikum everyone, and welcome back to our podcast titled Crucial Conversations. My name is Sukaina Takim. I'm a psychologist and mental health counselor and your host for this podcast series. And on the podcast with me today is somebody with so much depth of knowledge on what we want to discuss today, which is addictions. So it's an honor and privilege to have a person with so much passion and expertise with addictions here with us today. So Karibu, welcome, Dr. Shahina. It's really wonderful to have you on today. And I'm really looking forward to a really in-depth kind of conversation and kind of take the stigma away from addictions.
Thank you for having me.
You're most welcome. I think we'll do a lot that addictions needs today.
Thank you. I hope so. We enlighten our minds and others.
Exactly. Okay. So as I said, there's a lot of taboo. There's a lot of stigma. There's kind of that attachment or association that anybody who has an addiction is got low morals or is of poor, is weaknesses. How or what in the medical field or the science behind it tells us differently?
Okay, so let me start by saying a lot of people don't understand that addiction is a clinical or a medical condition. It's a chronic medical condition. It's a chronic mental health condition, and it can be treated. It is like having any other medical condition like diabetes or hypertension or cardiac problem, which is a long chronic medical condition, but with lifestyle changes, with treatment, with support, a patient or a person can have a normal life. It is just like that. Just because it is associated with certain behaviors or certain patterns or certain substances, it is looked at upon in a very negative way. But it can be very well treated and controlled with proper support and treatment and care.
Okay, so I think we need to kind of have that mindset shift in terms of it's a chronic illness. It can be treated. Yes, sometimes it is difficult to reach out because as opposed to a diabetes or a hypertension, which is so accepted, anybody with addictions kind of feels, how do I start about that process? Will I be able to get cured? Will I manage it? Of course, with the addictions, it comes with its own set of problems in terms of it is difficult to break that cycle, but it's very much doable.
Definitely. With proper support and care, and even with diabetes, if a patient is diabetic, they need family support to have a proper lifestyle change, meal plan and all. It cannot be done by one person unless that person lives alone. And similarly, addiction also, and it is because a lot of people think it's only about substance, but addiction can be behavioral addiction, it can be faith related, it can be activity related, it can be emotional related. Addiction is a very wide field, or I should say, it's a very wide name given, but there are so many other aspects of addiction. Usually substance addiction is always associated with other addiction that they have, and which is actually not regarded, and that is the first place. Maybe they are emotionally challenged, or they have gotten into some kind of childhood trauma, or they have stress issues. They have to have certain roots that is causing this addiction.
Okay, so I think that clarifies quite a bit in terms of, it's just as a person who just wants to make their life difficult, or who is, is of poor character or has weaknesses. There's a root cause that leads a person to being addicted. You mentioned the different types, and I think I wanted us to discuss that a little bit in depth. So in terms of the substances, so we have kind of, maybe you can give us a bit of a breakdown in terms of behavioral. And when you say emotional and faith-based or activity-based, I know people become really addicted to working out, for example, yes, or to their sport that they play. And then the effect or the consequences, sometimes it's unintended, I realize. What does it do then? What makes it from a sporting activity or working out to an addiction, and what happens between that process, kind of the stages that lead it up to becoming an addiction, especially when it's non-substances.
So addiction, by definition, is something that is so compulsive that you cannot control. And one of the factors is that it is so obsessive. You become so obsessive with that particular thing or function or whatever that you can't stop it. Whenever a human being does something beyond its limit, it is harmful. Even we are told when you overeat, it is harmful. Yeah. So in terms of different types of addiction, for example, I will tell you about physical fitness. It is an addiction when somebody you see, even if he's not feeling well, but wants to go and gym or wants to jog. A little bit of everything is fine, but when it affects you negatively, that is when it is a problem. That means it is affecting your health negatively. Similarly, people have emotional traumas, let's say childhood trauma, divorces, or people, what we see right now, wars are going on. When they go through a lot of traumas, they don't know how to handle their own emotions, and later on they bundle up inside and they keep on feeling bad about a situation, or different situations in life come and it re-triggers that, and they want to feel good, they want to feel better. So they look for something or one to feel better. There are people who have people addiction or relationship addiction who cannot sleep or be alone in a room. They need somebody all the time. That is an addiction because that makes the other person not have a normal life. Neither do they have a normal life. Or you will see some people after some time end up breaking relationship. They just can't handle a relationship for a long time. That is a problem. There is some trauma that is within them and they need to heal. So apart from that, there is behavioral addiction, which is very common in our society, and that also people don't want to talk about. Yeah. For example, gambling, masturbation, or porn. These are behavioral addiction. And these are even harder to handle, even when they are brought to rehab, because it is something that is still with them. They cannot stop it. It's not like substance that you refrain them from having it and they can, overcome with the withdrawals and that sort of that. This is within them. The feelings, the emotions, the feeling that they want to feel good, it is within them. So that is even more harder to take care of. And these problems, by the time they are discovered by the family or they themselves feel that something is wrong, it's a long, long time. And a lot of people don't understand that it is not like taking a pill, just like hypertension and diabetes, but this takes a very long time to heal because it is trauma. It is learning how to feel the emotion, accept it, and then work on it. It's a long journey.
Yes, it is a process.
Yes.
And I think, as you said, the acceptance, the commitment to wanting to change those behaviors, the support systems that are required, it is a long process, and kind of having to untangle the core or the root cause and then working towards that healing process and maybe finding something else that could be more favorable in your lifestyle as a coping mechanism.
Absolutely. Yeah. And everybody takes their own good time to heal. Some may take a year, some might take 6 months, but some might take way longer than the others. And it's not a thing to judge. It's just like I said, diabetes. Some people take shorter period of time to heal and understand their disease and work on it. Some people take longer.
That's true. I think you need to kind of, again, that kind of understanding that the recovery process is very individualistic.
Yes.
Everybody has their own strengths in their recovery process. And as long as we see progress, I know as in the medical fields, we kind of always want to see progress. Yes. We don't want perfection. We don't want that, oh my God, I need to get there and however I get there. We want to see that kind of daily progress or improvement. Yes. And that's when we know that this person is on the right track, on their healing journey. And that's very, very important to kind of understand when you start a process like this. So even if it is in therapy when you want to heal, or if you want to untangle your root cause of your addictions, that kind of understanding that we need to be, it's you on your journey.
Yes,
And the judgment, I so agree in terms of it's unfortunate, but I think it's part and parcel of our society, the judgment that we have. And I think, again, it comes down to every individual person to try to refrain from judging. It starts with every person putting it into the pot of, I'm not going to judge.
We need to learn to be more empathetic. For example, people ask me, why are you so interested in addiction? Have you ever been, or your loved one been addicted? And that's not the case. Not that I know of, but I have seen how they suffer. I've lost a lot of patients who were addicted, and usually we feel that maybe if it is alcohol or or drugs, you can treat them in the hospital, just get them medical detox and they're going to be fine. But that is way deeper than that. And it took me a while as a doctor, as a physician, to understand that why they keep on, we counsel them, we tell them your liver is affected and you're going to be, you'll die if you don't stop, but then they still don't stop. That is when I really took interest in learning, what is this thing? Why can't they just stop? And this happened when I lost a couple of my patients. And that is when I had a better understanding. And because it's an obsession, it is very hard for a person who is not in addiction to understand. They think they're doing it purposely. This is their behavior. They are never going to change. But the perspective of addiction is totally different.
Yes, I think through my research, I have seen that. And it kind of plays with the brain pathways in terms of the reward it gives you, the tolerance, the kind of, as you said, it's an obsession. So unfortunately, some people who are addicted to hard substances tend to do anything and everything to get to that substance. And that's when that stigma gets attached to addictions. But I think it plays a lot into the neuroscience of the brain and how the brain pathways are and how this kind of, I know we keep saying, the dopamine and this, but I think when we actually understand how dopamine works and the reward pathways is when we can understand addictions.
I would like to also add regarding the behavior of an addict who is in active addiction. A lot of times family also want to shun them because of the behavior they end up having with the family or due to finances and all. But I want to explain this. Thank you for this platform so that I can make people understand better. It is so bad a compulsion that they do not see what is right or wrong. The withdrawal that they go through, it is severe. Sometimes it is so severe, so painful. As you said correctly, it also affects our thinking, our processing of the information and acting upon that information. So there is delayed response, or there is a basically I would say haziness in making a decision. So when they are told that this is the amount of money that is there, and this is for food. For them, when they are feeling like dying, they don't find food important. Yeah. They need to survive in order to, to live. They need to make a statement there that, no, I'm more important. Of course, there are other things that are leading them to think that way. But again, because it interferes with a neural pathway of the brain, the decision making is very skewed. They look like they are very selfish, but it is how they feel inside. It is like a person when they are hallucinating. That person is hearing or feeling or seeing, believing that this thing is there. So when a person who is not hallucinating is in front of them, they feel like, what is wrong with them? There is nobody here. There is no sound. There is no, why is this person seeing things that are not there? This person is crazy. Yeah. And a label is put up there. But for that person who is going through it, it is a real thing. It is the reality that they are seeing or hearing things. And they are really fighting within themselves that my own loved ones don't understand me. My own loved ones don't want to help me. I'm saying I'm suffering, but instead of helping me, they are labeled. So there is a lot of shame, there is a lot of guilt, there is a lot of resentment that goes along with it. And this only grows with time. Yeah. Because neither of them understand each other. So it's very important to be in their shoes and empathize and understand, try to listen to them, what they are saying or suffering. it reaches a time where they stop communicating because they know you will not understand them. And that is really sad. That's because sad. When they stop communicating, then they go out looking for support outside. And the only place they feel supported or heard is the group they use together with or do that activity with.
Yes. So it kind of becomes so cyclical.
Yes.
And they don't know what to do.
It's a vicious circle.
It is. And I think in kind of platforms like this are just educating people on what addictions is on the flip side. You know, what that person goes through who is addicted, who is sort of crying out for help, but it's not being taken up. If anything, it's being shut down or it's being pushed away. So I think hand in hand with what we do medically, the support systems have to be there, the family has to be there, the friends have to be there, whatever support systems are available to the person. And, you know, just kind of seeing addictions through a different lens. So, Dr. Shahina, I think it's beneficial for our viewers. You have more than 15 years of experience in the medical field with the addictions. What kind of patients do you tend to see more of? Where do you see the problem areas in addictions? Specific substances or specific age groups? Does it affect our work? Does it affect our relationships, our parenting? Maybe you can shed some light on that.
Okay, so addiction cuts across all genders, all ages, but mostly they start when they are young, just as experiment or maybe peer pressure. And then it moves on from there, because when they do use it, there is a feeling of good sensation, some confidence, and then every time they need confidence or they want to feel good, they continue using. But it starts showing or affecting when they are in the work age group, because they've already gone through the pleasurable or fun era of their life. When they are out there now, they are starting work. That's when the challenge starts. That's when a lot of people would have families and responsibilities. And the more they feel pressured, the more they would go for the substance. So a lot of clients that I see are people who are in working age groups. Those people who can actually, grow our socio-economical status, who can support families, who can grow and, have better life. Those are the age group that are more affected. And what is unfortunate is a lot of them already show these signs when they are at work, because at work we spend so many hours, sometimes even more than at home. And by the time you actually are noticed at home, because there's so much other factors involved, emotional factors, or maybe today he's tired, or, but at work where you give, your output is seen, people notice it first, that this guy doesn't look okay, he's off. Maybe this week he was off. Now the whole month he's been off. So it is readily picked up by their output at work. And by the time they actually realize or show the support or concern, that person is like really, deep into the addiction, and they do need admission. But if these kind of things were, as you said, the taboo, these are taboo topics. So even at work, people are like, should we talk about this? Should we even, raise it? If it would be a thing that was being brought awareness even at work, a support system even at work, just the way schools have counselors, if work also had, it would be normalizing to, have a talk session or relaxation therapy, or, somebody you can confide in, then it would have been early picked up then. What is worse is that this is also known as a familial disease. So once a parent is addicted, it carries forwards, the gene is altered, and it's carried forward into the generations to come. So if we don't bring this awareness and normalize talking about addiction and how it affects negatively with time, a person who is using early on will not show any negative signs. Yes. With time, you will see the negative effects of it. And the longer it is, the harder it is to get over it, because the causes are so deep-rooted. To heal all those causes becomes harder.
Yes, of course. I mean, if you've been a user for more than 10 years, 20 years, there's a lot of back work that needs to happen for that person to be clean, to come out, to heal. There's no point just taking the substance away, but without addressing the root cause, we're not doing anything for that person. Okay, this is interesting in terms of how the workplace is, is more of our home than our actual houses or homes. And there's a lot that we can do for addictions in the workplace. I think it's a really good idea to have, as it's right, we have the counselors in school. Companies can kind of do that for their employees, especially the larger ones. This can be outsourced. It can be done in very different ways.
I think even in our society, in our culture, when we talk about I'm going to a counselor is looked upon very negatively. But even a friend or a parent or a child can be your counselor. A counselor is like a friend who you can open up to because they are not supposed to judge us. And any loved one, any friend, any sibling or cousin who you are connected to, have trust with, can be your counselor. So I don't know why is it okay to talk to a mentor or a friend and it's not okay to a counselor. And a counselor is more professional in terms of, giving help in the right, timely manner than a person who you can talk to, because maybe you're talking to somebody who doesn't know how to help you. But it's like talk therapy, and that should be normalized in every workplace, in every environment. I really believe that that's one of the coping mechanisms for me. When I talk it out, I feel better and it's out. And a lot of us don't want to talk about this. So there is shaming, there is so much stigma because we are labeling them. That is why they become like, they feel that no. If I talk, this person is gonna label me and shame me, and then there is guilt and resentment. So it's a whole circle.
Yeah, exactly. In terms of people wanting to seek help, but then feeling restricted to seek help, the stigma around it is therapy as well. But as you said, anybody can kind of start off that process for you, as long as you're able to find a release, if you're able to talk it out. I know I tend to kind of advise a lot of journaling, because if it is difficult to talk it out, write it, release it from your body. The act of writing kind of just does that. It gives you the clarity that you want for whatever it is, again, So I think it's really important to have support systems, to have somebody that you can reach out to.
Support system is also very important even after treatment. Once they are out there back again, unfortunately, the stigma follows them. And it bites them so hard that to go have a normal life is very difficult. So a lot of them will change their fields if they are, in certain field at work, so that they are not seen, because people will not believe that that person has changed. A lot of them will change cities or countries so that they are not, seen by the same people. So in addiction treatment, there is something called places, people and things. Places, people and things are the things that they're supposed to be avoiding. And if they feel that these places and these people and these things are going to be taking them back to where they felt the worst of their time, then they should be avoiding it. And to avoid that, so that they can have normal life, a lot of people go through a lot of challenges. For those who were working or don't get jobs because they lost a job, maybe because of a certain event, maybe there was a behavioral event that had happened together with that addiction. Again, because of their lack of thinking and making correct decisions, they don't get jobs. So to put them back to have a normal life takes a lot of input from the society, from the support system, from the rehab centers, from the doctors, from a lot of other, it's not only rehab treatment and client and family. It goes way beyond. We have social responsibility to normalize this thing, to welcome them back, to make them feel loved and wanted, and give them that a chance.
Absolutely, absolutely. I think we are failing to understand the level of courage it takes for a person who has an addiction to break that addictive cycle, to come back, to kind of heal, become clean, and come back into society is a huge thing, and the courage and the bravery required is commendable. And unfortunately, we don't see it like that, or it's not being seen like that. Yeah. So there's a lot that the addicted person does as well. And if anything, I think they do the most amount of work to get themselves back into society.
There was a time I really wanted to have my clients who have normal life now to come and talk about it so that other people get encouraged. But the stigma and the shame behind it, most of the families were saying, no, that part of the life is forgotten. Please, we don't want to, say it again. A lot of clients are really willing to do that because they really want to help others. Yeah. I wish it was just like cancer. Yes. Those who survive cancer come and openly, proudly say that I've survived it. I suffered. My family suffered. We all suffered. But today I'm in front of you and I survived. It is very similar to that kind of torture. It's not easy. They go through a lot. But then, unfortunately, because of all this taboo and stigma, we push them back into it. And a lot of people, a lot of youths, a lot of people go back to their addictions because they started feeling the same feelings they had when they started. So they feel like, I rather feel good than bad. Yes. I rather go back using. And they go back using.
Yeah, they relapse. And sometimes we don't realize the amount of play we have into that decision making. Okay, so Dr. Shahina, when I was kind of doing a little bit of research into addictions, and it was quite shocking, the statistics on the youth and how the youth today are so much more affected by addictions. I think what I had here is that in Africa, 70% of the people who are in treatment are under the age of 35. So that's a huge number. And that is only those who are in treatment. I think from my other statistics, I said it's only 1 in 5 who need the treatment are in treatment. So there's huge gaps. And with Africa, in terms of our limited resources, is this something that you see more often, that it's the youth or the younger working population or the future population that are kind of being affected with addictions? And maybe you can tie in Tanzanian statistics or substances that are readily available in Tanzania.
Okay, so yes, absolutely. That's absolutely true. It's not only for Africa. I think worldwide, you will see that youths are more affected, or the age group that are supposed to be giving back to the social economy of the country or of the society. And as I said, they start as fun, but when they do get into addiction, they are already in the working age group. Unfortunately, that is reflected even in my clients. So majority of my clients are between 30 and 45. And there are clients who come after the age of 45. I had an oldest client who was in his 70s, late 70s. But then it starts very early until they are really in bed state. That's when they are brought. Unfortunately, there are substances that are legal and there are substances that are illegal, but legal substances are not controlled in our country. For example, alcohol. It's a legal substance, but you will see that even kids have access to it. And there are no timings for selling these things, though it is something that people use as a leisure or for fun or for rest, but it is available any time of the day that you need. Similarly, tobacco. It's a legalized substance, but nobody is looking or watching who is buying. What is the age group that is buying? There is no such research in our countries, unfortunately. The other substance that is readily available and very cheap, dirty cheap, is cannabis. And this is a substance that is very famous and very popular. After tobacco is cannabis, and then there is alcohol. Still, alcohol, as a kid to go buy alcohol, it's still a taboo. But I know from the clients and from the youths that I talked to, one of them was 8-year-old that he started using cannabis. And it was very simple. As I said, it's familiar. So somebody at home was using, and he saw, it littered and just put aside, and he started smoking. Of course, the family did not know. By the time they knew, he was already a teenager, fully, full swing addicted to it. So these are readily available. There are other substances that are not readily available. There are things that are really sold, under the carpet or behind the doors, and they are a little expensive. But the most cheapest are these three: cannabis, tobacco, and alcohol.
Yes, and I think that would be seen in a lot of the countries, a lot of the societies, in terms of the availability of alcohol, nicotine, or tobacco and cannabis. It's unfortunate that those three have kind of become normalized in terms of they're so readily
even
available.
Culturally. Yes,
you can send your kid to the shop to buy you a cigarette, and there's no big deal about it. Because it is so normalized. And I think on the back of that, I really want us to discuss the prevalence of nicotine, tobacco products, things like vaping and e-cigarettes and shisha and
the in thing right now.
Exactly. So I think because it's so in, it is so, it's cool. It comes in different flavors, especially with the vapes, which is very prevalent with our youth today. Not only our community, but the wider society.
Yes.
I think all the schools and all the community centers are struggling with vapes. It's cool. It was initially marketed as a better product than the cigarettes for your health, which now we know is absolutely not.
Yes.
Can you shed some light on the harmful effects of the vapes and the fact that I believe it is illegal in Tanzania?
Yes. So it's shisha were banned. We used to have shisha places, and it's banned because they know that shisha is like e-cigarette. E-shisha is just like vaping. It's tobacco. Unfortunately, it's a very in thing. It's been an in thing for a while, but with the flavors and with something that is not, giving out smoke and easily carrying in the pocket, and it doesn't even look like a cigarette. It's very easily put into the purse or in the bag without anybody noticing, and because it doesn't have smell or smoke, it is, you can do it anywhere, in the office, in the bathroom, and nobody would know. That makes it even worse. What is even worse is people don't understand what is vaping.
Yeah.
Vaping basically comes from the word vaporizing, and these, if you see the history of vape, it was created to help people to stop smoking.
Yes.
Initially, and then they realized that actually it's not helping. And then there was a phase of maybe around 10 years after initiation of these vapes to see, there were people who were getting really sick, those who were exposed to vaping. And there's so many very famous hospitals like John Hopkins have done it to know what is it causing this problem. And they realized that the things that are put in vapes are actually causing permanent damage to the lung tissue comparative to the other normal cigarette that people smoke. And I'm not normalizing cigarette, but I'm just saying comparatively what we think it's cool is more harmful than the normal cigarette. These vapes have flavors. Flavors are just to give us taste in the mouth. But once that is inhaled, the effect that it causes to the lung is detrimental. They also put taste enhancers, which is usually a food product, which is okay to ingest it for the intestine. But when it goes to the lungs, the damage it does is horrendous. The lung is like a dry sponge where air comes in and moves out. So when there is anything that is sticky, these chemicals are sticky by nature. When the sticky stuff gets into the lungs, can you imagine if you put the sponge into a oil and then you take it out? Even if you try to squeeze all the oil out, the sponge is going to remain sticky. It's not going to expand fully. That's exactly what happens to the lung. And with time, they have proved that there is this damage that is done to the lung is permanent and very fast comparative to the normal nicotine smoking. Some people say it's because of the filter in the cigarette, and while shisha and vapes don't have filter, there is a little filter that is put in there in the vapes. If you see, you can Google it. It's there, out there. What are the components of the vape that is available? The filter doesn't really do any filtering, because once it is going into the lungs and you are exhaling, basically you're trying to exhale the byproducts, and so the damage is twice. You're inhaling the toxic substance, and then you're exhaling the byproducts of the toxic substance. So the damage is worse. The other thing is that a lot of vapes, maybe people don't know, a lot of vapes are not tobacco only. Some of the vapes also has cannabis. And when we are normalizing it for the youths to use it, you don't even know what they are putting in. I always tell them example of when you have a food, a menu in front of you, you choose what you want to eat. How will it taste, but also how you will feel after eating. So how about we think about it in this way? You want to put this substance inside yourself, find out what it has, then make the informed decision. Look at the ingredients of the vape. Are you sure what you're putting inside your lung is healthy for your lung? Just for few puffs and looking cool, is it worth damaging your lungs forever? These are kind of things that we need to talk about so that people understand, because honestly, people really think it's just flavor, it's nothing, it's just mist. No, it's not a mist. There is component of tobacco. Some vapes also come with cannabis and God knows what else. There are certain chemicals that are also put in there that are, as I said, initially used in food products that we still don't know the effect on our lungs, and the researches are going on.
Okay, that's a lot of, I think, eye-opening in terms of what exactly is in the vapes and what it does to you, and the fact that there's not so much research on it available in terms of long-term side effects and long-term kind of damage. So thank you. I think that's really important for our viewers to kind of understand the science behind vapes, and it's not just this cool thing that everybody kind of wants to do. I think we understand that when you're an adolescent, you want to do the cool things. But as you said, I think what I picked up from that was the informed decision.
Yes.
Our youth today are very exposed. They're very smart. They have the information at their fingertips. Find this out as well. I think it would be beneficial. Okay, great. So I think it's quite evident that the youth kind of, with the risky behaviors, tendencies, they tend to find the vaping or the smoking, cannabis, the experimenting with alcohol, other behavior, the gaming or whatever it is. But what about the kind of the elders of the society, or that kind of gap, that age gap of, 40 plus or whatever it is, when they're battling different challenges in their lives? Do you find that they have one kind of specific addictive tendencies in terms of, do you find them gravitating towards something that they can hide? With alcohol, there's always a repercussion with it. Is that something that you have seen with your experience?
Yes. So again, alcohol would be the number one go-to because it's readily available. But the other one that is very common and very much accepted is hospital medication. So prescription medication that are addictive, people think because it's medicine, it's okay to use. And they keep on refilling it, and without understanding the repercussion over a long period of time. When they see that maybe one pill doesn't have the same effect, they self-medicate and increase the dose, and by the time they realize that, oh my God, now I'm taking 2 of these or 5 of these or 10 of these and I still don't feel it, is when they realize that something is wrong, and by then it is kind of too late, because if they don't take it, they have withdrawal symptoms, they can't think right, they can't function. And I have gotten such patients and clients who were prescribed very innocently by a doctor for pain or post-surgery pain. There was elderly who had arthritis who got prescribed with opioids, and with time he became so addictive he couldn't move out of bed until he injected himself opioids. with overtime, he realized, and family also realized that now this is not the real pain. This guy is needing it way more often than required, and then they need a treatment. So these are the things that we should also be vigilant when we are given painkillers. There is a specific period of time as a doctor will write for you. If you go beyond that, go back to your doctor and tell them my pain is not better. Can you offer me some other, therapies? And the doctor can then guide you. But if you keep on self-medicating, especially again in our country, we do not have control over the counter drugs, and people buy anything, almost anything, over the counter. And there are certain medications that are very addictive, like opioids, very addictive, like sleeping pills, or opioids for painkiller, but then also psychoactive drugs like sleeping pills or anti-anxiety medication. Anybody can buy these medication over the counter, but once it goes beyond certain time or number of days, it becomes addictive and you can't quit it on your own.
Yeah. Okay, that's really interesting that you give us that perspective in terms of, sometimes we feel it can't be happening here. It can't be happening in our society. That is a first world, problem. But I think, as you said, the ease of availability of really anything that you want in a pharmacy, you will get. And with the opioids, I know how addictive it can get. And, I think we had the kind of opioid crisis in the US, and it was fueled by prescription.
Yes.
And the doctors just constantly writing out refills and not kind of figuring out this doesn't look right. So that's really interesting that we kind of have that here.
So we are in that phase right now. Yeah. And because it is prescription medication, even family feels like it's okay, it's safe. But not everything is safe.
Yeah, and you feel it came from a doctor. So, but when you start self-medicating and you keep pushing up your tolerance levels, then, so as you said, you need to go back. Go back, see your doctor, figure it out, find out why your pain has not gone away, even with your medication. Okay, interesting. I think I'd like us to move. You have a wealth of experience, and of course you've seen anything and everything in terms of with the addictions. You have the success stories, you have the relapse stories, you have everything. Maybe if you could share one story or real life experience with our viewers, just to give them, something to hold on to in terms of this is kind of the journey, this is the process, and this is what comes out of it.
I have so many, as you said, stories, but one particular one is close to my heart because when I see this client or this person, a human being, I feel good that he has a normal life. And that is the sole purpose of getting into this addiction, understanding it better, opening a center so that people can get help. I had a client who was brought in against his will. This was a gentleman who was an accountant by profession, and he had started using cannabis when he was in school, and it continued just for fun. But after school, and he aced it. He was a very good accountant. He wasn't getting a proper job. He got a job in a bank as an assistant teller. He really strived for 3 years to become a teller and to grow, but people wouldn't let him, or the life wouldn't let him. So that frustrated him, and he started drinking. Over a period of 1 year, he became so addictive to alcohol that he could not go to work without binging in the morning. And of course, being in the face of public in bank, he lost his job. When he lost his job, he felt even worse because he felt like, I've strived and I thought I will finally reach somewhere, and I lost it. So he became even more addicted to alcohol. He wouldn't leave. And alcohol is a non-depressant. So the more you drink it, the more it is in your system, the more depressed you will feel, and the more you will drink. So it's a vicious circle. And so he became depressed, he wouldn't leave home, and it was so bad that he would pass out. That is when the parents realized that something is wrong. He can't be just drinking because he is jobless. and because he was jobless, the doses were more. So he was just picked up one of the days that he was picked up in a bar unconscious. He was involved in the bar fight and he didn't even know. He was bleeding, and the parents decided to bring him over. When he woke up, he was in the rehab. With time, he started believing in himself. He started understanding what is addiction, because we kept on telling him, how was your life before you became addicted? Weren't you acing? Weren't you a good student? Aren't you a good son? Then is it worth it to lose it all just for few years of, feeling like a failure? When you fail is when you start winning. That is when you will strive and you will start winning. And slowly with time, he also learned about addiction, how to control his cravings, how to control his emotions. He learned a lot of positive coping mechanisms when he was with us. And with time, he was ready after 8 months of treatment. And we were really concerned, because we know when they go out, they don't get a job. But fortunately, he got a job. He started again very down. So we were following up with him, and we kept on encouraging him that it's okay. Be grateful you got a job. You will, eventually climb the ladder. You can't start on 3rd floor without going on the ground floor. So with time, today he has a very good position in the bank. He comes and visits us, but of course, that is his past, but he always remembers, and he's very grateful for the help that we have given. Even the parents call us, eventually, even the parents understood that it was a phase, and with proper support they could give him. He avoids even the parties or socializing places where there is alcohol. There are places that he should not go, and with that support he grew, and today he is really doing well, and I'm super proud of him.
That's amazing. That's amazing. That's phenomenal in terms of the effort, the help, the thought, everything that you provided for him. And he is so appreciative of it. And he's doing so well now. It was just, as you said, it was just a phase. And I think if we approach it in that way, it's just a phase. It's sometimes a lot of other factors outside that are feeding that. And then we just don't know what to do, and we end up becoming addicted. And if we look at it like that, and we're there to support, that's exactly what you did, what his family did. And now he's where he was meant to be. Yes. Amazing. Great. There's a lot we have discussed today, I think, from what addictions is and where it goes and how it needs to be addressed, supported, what somebody who is struggling can do, what they cannot do, and the fact that it is something that is treatable. What can you leave our viewers with, or the community at large with, in terms of addictions and, removing maybe a layer of that kind of stigma that is attached to it?
Thank you. I would want to say that nobody is perfect. Everybody has flaws. We just need to learn and appreciate those flaws. And addiction starts from feeling bad, negative, sad, guilt, shameful. And if we started appreciating those flaws that we have into being grateful for the blessings that we have, maybe we will make this world a better place. I also want to say that it's okay if somebody has gone through addiction and has slipped in life. It is our social responsibility to hold them up, to bring them up. I'm sure all of us have gone through a phase in life where we needed support. And addiction is just like that. We need to support them. We need to pick them up. We need to hold them up. Even if they are wanting to fall down, they will be held up if we as society support them. And support can be, not everything is money. Support can be kind words. Support can be just giving them, your time, or showing that you care and it's okay. You're not judging them and they can open up. And maybe you can, offer the help that is available. What are the options that can be done? Talk to the family to tell them to show support. Help is not always money. Help can be from within, inside. If you act doing this sincerely, that is enough support to support them. And I would also like to say, we all deserve another chance. So for those who are really trying to get back to normal, they all deserve another chance. And why not? What can be the worst that can happen? They can go back to it if we don't support them. But if we do show support, maybe they won't go back to it,
That is absolutely right. And it's so powerful, powerful words, Dr. Shahina, in terms of the responsibility that we have as a community, as the wider society, and we play a very significant role. I think that is one thing that kind of in the awareness that we want to create today is that kind of the message we want to leave our viewers with. You have a role to play.
Yes.
And whatever that role is, as you said, absolutely right. It doesn't always have to have monetary attachment. It could be that one word, I'm here for you.
Yes.
And that is enough. That's kind of the lifeline that person needs to like, okay, I can get myself out of this. I don't no longer want to keep drowning. So that's absolutely right. Thank you very much.
Thank you for having me.
So I think I would like to add on to that and say we're here to help. If you or you know somebody who is struggling with an addiction, and you can reach out to us here at CareSpace or a trusted medical practitioner. We're here to help you. We're here to support you. We're here to guide you. We understand it's a difficult process, but there is the help that is required, is available. Thank you again, Dr. Shahina. It has been eye-opening. It has been a pleasure speaking to you today.
Thank you for having me.
Thank you very much. I've enjoyed it today. And thank you to our viewers and listeners for tuning in today on this really, really important topic of addictions. I really do hope you found it educational, insightful, and it gave you the message that we were trying to put across. Thank you very much.